Doctors often hear that they have to work on their practice and not just in their practice. But how do they do that? Well, first, take a 10,000-foot view of your practice to see where you really are. What is happening in terms of patient flow? How many new patients do you schedule each week? How many hours are spent in clinic? How much time is spent documenting patient visits? And so on. Then consider what can be improved with a specific goal in mind. After all, what is the point of changing things in your practice if you don't know what your end goal will look like? First, determine what you want your ultimate practice to be. Would you like to see less patients but make the same revenue? Would you like to have more time to spend with patients and not feel rushed to do paperwork? How about have enough time to take breaks and lunch during the day so that you can recharge and better assist your patients? Now, I know many of you will push back and say that this isn't possible, and that's where the most important question comes into play. Instead of saying that something isn't possible, instead ask, if it was possible, how would I make it happen? Or, if it was possible, what steps would I take? By asking questions that start with, if it was possible, this opens up your mind to possibility thinking. All of a sudden, you'll start to hear an answer in a colleague's discussion about changes that they've made, or you'll hear a clue in a podcast, or you'll see results in the growth of a competitor, or maybe a passage in the book that you're reading will suddenly answer the question. After all, you can't find what you're not looking for. By asking and re-asking these if it was possible questions, it puts you in a frame of mind to search for and find the answers. Remember, all things are created twice, once in the mind and once in reality. So you have to think and envision before you can create your idea in reality. Now, over the last 2 decades, I've done just that with doctors in private practice. I've explained what's possible and how they could create the practice that they've dreamed of by adopting patient-centered services. If you have questions, schedule a 15-minute call at the link below. And until we talk, here's to your continued success. Take care.